Hi friends, I am Dr. Pratap Singh Rathod. I have done the MD in Forensic Medicine. In today's video, we'll talk about investigation of of death in case of a drug abuse case. Death often occurs in drug abuse because of drug combination rather than the abuse or overdosage of single agent. Usually, the person who uses a substance abuse not only uses single drug but he uses combination of drugs which leads to death. Usually unexpected coma followed by death or irrational behavior before a bizarre act resulting in death, especially younger people, should raise a possibility of drug-related deaths. So if any death which any patient who comes with the unknown case of coma with irrational behavior before death should raise suspicion that he may have been consumed drug which has led to drug abuse and led to death. Coming to scene of drug abuse cases, in death cases of scene, usually there is photographs of scene and surroundings objects should be taken. The surroundings should be searched for any drugs and if found should be preserved. Next, usually there is a needle, a syringe, a cooker, lighter or cracker are usually present where the person usually prepares the drug. Tubes of plastic glue, plastic bags which indicate mainly the person may have been using volatile or solvent abuse. Then aerosol cans, balloons which indicates he may have engaged in huffing where he smells from a plastic bag, chemicals, solvent he used to volatile substance he huffed. Then there may some apparatus of drug preparation may also be found, like usually where the illicit narcotics is diluted narcotics by quinine mannitol is placed in water in small receptacle like a spoon or a cooker, and it is heated until the powder dissolves. This solution is then drawn into standard syringe with cotton to filter out the insoluble particles which is injected into the person. So this apparatus usually may be found in the scene of crime. The apparatus if found is sent for analysis to detect the contents of which the person may have consumed. Then we have to examine the clothes. The dead person's clothes should be examined and described for drugs in pockets or hidden in seams, belts, shoes, money, purse, eyeglasses, jewelry, etc. may be present. Then coming to external examination, the body should be examined for drug that may be hidden inside the body orifices, taped to the body between the buttocks, toes, under the breast, attached to string or tied around tooth, may be swallowed also. Rarely needle and syringe tourniquet may also found in the place on the with even in the present on the body itself. There is often wasting and signs of self-neglect. Tattoos may be present on the body, usually done to hide the scar tissues as well as the needle marks. Stains may be found on the body on the tips of the finger, which indicates the possible types of pill or capsule handled. A callus on the medial aspect of thumb, which is also known as cracked thumb, which occurs due to repeated use of butane lighters or heat to heat the crack, that is cocaine, is seen. Burns on the lower lip due to smoking hot glass or cracked pipes are commonly seen. Excoriations of anterior chest wall are usually a sign of chronic opiate abuse. Linear tracts, scars often pigmented, are usually found in the overlying fibrosed cord-like veins of antecubital fossa or forearms or in the dorsal of the hands in male learners who chronically use the injections chronically use injection for drug abuse. In them, the veins usually becomes fibrosed and becomes like a track will be seen. Sometimes linear tracks are found on the scalp, neck, subingular regions, shoulder, inguinal region, penis, vagina, pubic area, ankle or foot. Punctuate areas of black discoloration will be seen. That is also called as shoe tattooing, where the veins marks will be deposited with carbonaceous materials along the track of needles called as turkey scene, as it resembles the plucked bird. Injection sites can lead to areas of subcutaneous sclerosis, fat sclerosis, abscess formations, and if injections are deeper into the muscles, they also lead to chronic myositis may be seen. There may be chance of chronic edema of hands, secondary to occlusive thrombophlebitis in the forearms. Incision through the injection sites may show perivenous hemorrhagic tract. So if the injection site is present, that part of the skin can be, if it is not clearly visible, incision should be taken, and there may be a chance that hemorrhagic tract may be present. Addict usually try to abrade the tract by overlaying it with cigarette burn marks, abraded with pumice stones, sandpaper, or using sclerotic chemicals. Maybe burn marks may be present in the whole body. The regional lymph nodes may be becomes enlarged. nasal passages, nasopharynx may be reveal irritations or even traces of drugs inhaled through the nose. Habitual inhalation of cocaine or heroin, usually by snorting or sniffing, cause irritation or congestion and atrophy of nasal mucosa. There may be perforation of nasal septum, varying in size from pinhead to several centimeters. GI tract may contain pills or capsules. Internally, when abdominal dissection is done, if the person has consumed some capsules, it will be found. When microscopic examination of stomach may be done, under polarized light, it may show particles, that is merely the starch, talc or cellulose which is additive added in the drugs may be found, or sometimes dye from the capsules may also be found coloring the mucosa of the stomach. Needle scars show perivenous fibrosis, abscess or diffuse subcutaneous scarring in the skin proper. When microscopic examination is done, there may be some foramenters may be seen in the injection site, like fragments of cloth, talc powders may be seen. Incisation of veins may show phlebitis, phlebosclerosis, thrombosis, and recent resolving perivenous hemorrhages may be seen in the veins. The vein and surrounding tissue should be preserved for chemical analysis to detect the confirm the drug abuse. There may be hepatic lymphadenopathy, hepatic portal thyroiditis, enlarged lymph nodes of the porta hepatis, and at the pylorus stomach may also measure up to 3 to 4 centimeters. Lymph nodes may be enlarged. Typical visual anatomic findings include non-specific pulmonary triad of edema, bronchopneumonia, and aspiration of gastric contents. This is typical triad will be seen in many cases of death by abuse. Froth is present in the mouth, then respiratory tract which comes out of nose and mouth. Lungs are heavy. In mainliners who chronically use the injection site, crystals lodged may be present in pulmonary capillaries and produce a foreign body granulomatous reactions may be seen. Such granulomas erode the walls of capillaries and unite, forming large granulomas. Most heroin addicts have fewer optically active crystals in their pulmonary capillaries. Pleura may show petechial hemorrhages. Lungs usually congested edematous with focal hemorrhages. Liver may be slightly enlarged or show evidence of cirrhosis. The heart may show valvular diseases. Pericardial, pleural, or peritoneal effusions may also be found. The brain may show edema, focal areas of necrosis involving globus pallidus and hippocampus due to hypoxia. Hypoplastic changes in reticuloendocrine systems are also commonly seen. There may be splenomegaly, portal lymph node hyperplasia also common. Coming to complications of injection of drugs, the person becomes self-neglect, malnourished, dental decay is seen. Thrombosis and phlebitis, granulomas, abscess formations, and gangrene or infections which may lead to septicemia is also septicemia will also be present in the injection site. Inhalation may produce precipitate asthma, bronchitis, pneumothorax, pneumomediastinum, and vomiting. Sharing the syringe and needles can transmit some blood-borne diseases like hepatitis B, C, HIV, syphilis, and malaria. Acute and chronic liver disease may also cause kidney problems, and amyloidosis also seen. Psychiatric complications are also present. Tuberculosis, pneumonia due to reduced resistance, and poor nutrition. Due to chronic usage, the immunity is diminished, leading to tuberculosis and other diseases. Accident due to impairment of alertness and behavior also seen. Squalor, theft, and prostitutions also will increase condition increase to get money to buy the drugs. Personal violence and murder is also common. Acute myopathy, meningitis, brain and pulmonary abscess, various neurological abnormalities, acute muscular necrosis, myoglobinuria, and renal failure also are some of the rare complications. Death can occur due to overdosage or from contaminations of drug abuse. Coming to overdoses and hypersensitivity, death may occur rapidly, especially with IV usage of heroin. Due to hypersensitivity, sometimes the first time users may die rapidly and needle means syringe may even be found in the vein. Death appears to be due to acute atrioventricular failure and gross pulmonary edema in these cases of hypersensitive reaction. Chemical analysis in case of drug abuse. Nasal secretions are usually useful for cocaine, opiates, and drugs which are inhaled such as or snorted. Blood should be preserved by under sodium fluoride and stored at 40 degrees centigrade. The sample of choice are blood and urine. Although nasal secretions, gastric contents, bile, liver, kidney, and lungs may be necessary to definitively identify the type of drug. Common methods of detection of drugs include gas liquid chromatography, thin layer chromatography, and spectrophotofluorometry. Toxicology radiology is also helpful in cases of few cases of drug abuse, like radioactive poisons like heavy metals, aspirins, acetylzole, etc. In case of body packers also, it will detect the presence of packaged drugs. Intestinal obstruction caused by drugs, effusion caused by drugs, alveolar rupture, granulomatous changes seen in the because of drugs can also be detected in X-rays and CT scan. Septic pulmonary emboli aneurysm can also be detected. Inert insoluble ingredients of oral preparations like talc can also be found in radiological examination in case of drug abuse. These are my references. Thank you.